Think you know Ocrevus? You go in, get the IV, watch some bad TV, and head home. Simple, right? But what if I told you there's a secret menu? An underground world of Ocrevus methods your neurologist might not mention. These aren't wild Reddit theories. They're real strategies top neurologists use to fine-tune treatment. Today we're pulling back the curtain on 8 weird, wonderful, and sometimes wild ways doctors use Ocrevus to fight MS. From secret agent injections to family planning with a French twist, we're covering it all. Don't go anywhere, let's get started. Before we dive into the wild and wonderful world of Ocrevus strategies, let's take a moment to connect. If you're finding these insights helpful, don't forget to hit that like button and subscribe for more MS tips and stories. And hey, your experience matters. Whether you're an Ocrevus veteran or just starting your journey, we'd love to hear from you. Drop your story or your own tips in the comments below. You never know who you might help by sharing. And if you know someone who could use a little MS motivation, go ahead and share this video with them. Together, we're building a community that supports, informs, and inspires. So join the conversation, give us a thumbs up, and let's make MS a little less mysterious, one story at a time. First up, let's talk about the standard Ocrevus infusion. It's a common starting point for many of us navigating the world of MS treatments. It's the method that a solid 95% of us use, making it a well-trodden path with plenty of shared experiences. You show up at the infusion center, get your pre-meds to help minimize any potential reactions, and then settle in to spend around 3.5 hours comfortably tethered to an IV pole. It's a bit of a time commitment, so bring a book or a good show. The first 2 doses are administered 2 weeks apart, acting as a sort of loading dose to get the medication into your system. After that initial period, it transitions to a maintenance schedule of every 6 months, so you can plan your life around it. It's a reliable treatment option, backed by extensive testing and research. And importantly, it's FDA approved, meaning it's met rigorous standards for safety and efficacy. It serves as the foundation upon which many other treatment strategies are built. It's a well-understood and established approach. The nurses are generally fantastic, providing support and care during your infusions, and the snacks are, well, let's just say they're edible. And the best part is that it works effectively for the majority of people who use it. Is it boring? Maybe a little. But remember, sometimes boring is exactly what your brain needs to stay healthy and stable. So here's to the standard method, the reliable workhorse of MS treatments. It's the baseline against which we measure all the off-label creativity and experimentation that's yet to come. Now, with that foundation in place, let's get weird and explore some of the more unconventional approaches. Meet the slow method. Ocrevus in slow motion. For people who react badly to the standard rate, doctors stretch the infusion to 5 or 6 hours. It's not for fun. It's for those with past reactions or certain health conditions. By slowing things down, your body has more time to adjust, reducing side effects. It's personalized medicine in action. If infusion day is rough for you, ask your doctor about this option. And bring lots of podcasts. You'll need them. Let's talk pre-meds, especially Benadryl. For some, Benadryl is a knockout punch, leaving you groggy or even hyper. The off-label move? Skip Benadryl after your first few infusions if you're tolerating Ocrevus well, or switch to a less drowsy antihistamine like Zyrtec or Claritin. The goal: prevent reactions without ruining your day. It's about quality of life, not just safety. Talk to your doctor if Benadryl wipes you out. You have options. The crap gap, that stretch of time. Those weeks, sometimes months before your next Ocrevus infusion rolls around. It's that frustrating period when symptoms slowly but surely creep back. Fatigue sets in, brain fog descends, and those familiar, unwelcome old symptoms return to say hello. It's all happening as the protective effects of Ocrevus gradually wear off. Doctors, recognizing this challenge, get creative. One potential option to consider is a steroid bridge, a short, carefully managed course of steroids designed to tide you over until your next infusion. Another strategy involves shortening the standard interval between infusions, perhaps scheduling them every 24 weeks instead of the usual 26. It's a delicate balancing act, because while more frequent dosing can certainly help alleviate those returning symptoms, it also comes with its own set of potential risks that need careful consideration. Ultimately, the goal is to keep you feeling as good as possible, and to maintain that feeling consistently, week after week. So, if you find yourself dreading the arrival of the crap gap, don't hesitate to talk to your neurologist about it. There are definitely ways to smooth out that transition and improve your quality of life. You absolutely don't have to just tough it out and suffer in silence. Want something more high-tech than steroids? Enter Kesimpta, Ocrevus's cousin you inject at home. Using Kesimpta to bridge the crap gap is very off-label and experimental. The idea: a small dose of another B-cell therapy to keep things steady until your next Ocrevus. It's not standard, but it's being discussed by top researchers. This is cutting edge, with lots of unanswered questions. Don't expect your doctor to offer it tomorrow, but it's a glimpse of the future. MS treatment is getting more personalized every year. Ocrevus knocks out B cells great for MS, but it can leave you vulnerable to infections. Some patients' antibody levels drop too low after long-term use. Off-label fix IVIG and infusion of antibodies from healthy donors to boost your immune system. It's not routine, but for those with recurring infections, it can be a lifesaver. Another strategy: stretch out the interval between doses to let your immune system recover. The goal is to balance MS control with infection risk. It's a delicate dance, but options exist. Talk to your doctor if infections are a problem. Some neurologists are ditching the calendar and dosing based on your blood work. They track your CD19 count, a marker of B cells. Instead of infusing every 6 months, you get your next dose only when your B cells start to return. This biomarker-informed dosing can mean longer intervals between infusions, less drug, fewer side effects, and fewer infusion days. It's the ultimate in personalized medicine. Not every clinic offers this yet, but it's gaining traction. Ask your doctor if this approach might work for you. Your immune system could set the schedule. Are you and your partner thinking about expanding your family? If you're managing MS with Ocrevus, know that it can absolutely fit into your family planning journey. It's about understanding the options and making informed decisions. Let's talk about the French twist method. First, you get your Ocrevus infusion, as scheduled. Then you wait approximately 1 month to allow the drug to mostly clear from your system. This waiting period is crucial for the next step. After that waiting period, you can then safely try to conceive. This approach aims to minimize any potential exposure during the very early stages of pregnancy. This strategy provides you with several months of effective MS control, all while ensuring the medication is largely out of your system during those critical early weeks of pregnancy. When it comes to breastfeeding, the good news is that most specialists now support it, because Ocrevus barely passes into breast milk, posing minimal risk to the baby. To further protect against postpartum relapse, consider getting an Ocrevus infusion after delivery. This allows you to manage your MS effectively and still breastfeed your baby, providing them with all the benefits of breast milk. It's truly a new era, offering more choices and greater control for women living with MS who are considering starting or expanding their families. Remember, family planning is absolutely possible, especially when you coordinate with the right timing and strategies. Be sure to talk to your neurologist to develop a personalized plan that aligns with your individual needs and family goals. 8 creative ways doctors are personalizing Ocrevus. Most people do great on the standard method, and that's perfect for them. These alternatives are for specific situations. Don't change your plan without your doctor. This video is about empowering you to have better conversations with your neurologist. Thanks for watching and being part of this community. If you learned something, like and subscribe to help others find us. Want more? Click the next video to keep learning.